Turning to other news now, is it time to take dramatic new action to address this country's opioid crisis? The latest numbers show that in 3.5 years, nearly 14,000 Canadians have died from opioids. Now, former Liberal Health Minister Jane Philpott is speaking out. She's calling for the outright decriminalization of a limited quantity of hard drugs. But Philpott's no longer in politics, having lost as an independent candidate in the last election. Is her pitch something any federal government would actually entertain? Jane Philpott joins us from Toronto. Dr. Philpott, the numbers clearly show that this is a crisis. How would you say, before we get into the discussion about decriminalization, how would you say broadly the federal government has done managing this crisis?
Well, you know, it's a huge challenge around the world. It's not just Canada that's facing rising numbers of deaths related to opioid overdoses. Certainly North America wide, it's a problem. I believe, particularly since 2015, under the Liberal government, that a significant amount of progress has been made. But when you're talking about 12 people every day dying of opioid overdoses, those families who have lost their loved ones will say that no government is acting fast enough.
Can you identify the moment, whether it was a particular interaction or a discussion, or how you came to this realization that you feel that decriminalization is the way the federal government should go?
Well, I've been a family doctor for over 30 years and was well aware of issues related to drug policy. I certainly had patients when I was a family doctor who suffered from problematic substance use, and it's an area of literature that I've followed for a number of years. So when I had the privilege of serving as health minister, and there was an immediate outcry from people in communities where they were facing large numbers of overdoses, at that time in 2015, if you'll remember, it was extremely difficult to get supervised consumption sites. And so I knew right from the minute that I had that portfolio in 2015 that there was a lot of work to be done based on a tremendous amount of really good literature internationally as well as coming out of Canada.
But decriminalization specifically?
Well, decriminalization, we have known for decades, is the approach to take, and drug policy experts will tell you about that, and they spoke clearly to me about that when I was a health minister. They continue to speak about that. I've recently written this article that talks about the international experience in that, and people often point to Portugal as perhaps the model country in the area of decriminalization specifically, that they were able to decriminalize the possession of small amounts of drugs in 2001 and saw as a result of that not only better health outcomes and saving lives, but also saving money and making the streets safer for people living in Portugal. So it's phenomenal that almost 20 years later, very few other countries have followed that lead, even though that's where the evidence points.
So what about you, though? Why didn't you try to do this as health minister? Or did you try and we just didn't hear about it?
Well, in politics, of course, there's a challenge in that you need to get public buy-in for big social changes. The Trudeau government in 2015 was elected on a very clear mandate around cannabis legalization and regulation. And that, I think most would say, has gone relatively smoothly given the fairly significant change in that area. There wasn't a mandate of that government around broader discussions of decriminalization. And I think society needs to support politicians in following the evidence. And increasingly voices are saying that decriminalization is the route to take, along with a number of other big policy changes, things that I've talked about, like the safe supply or the availability of clean drugs for people who have substance dependence. But there has to be a building of political will, and hopefully that will increasingly happen.
Did you try to advocate for this when you were health minister, though?
Well, I made significant changes along with my colleagues in government that were well supported in terms of things like a bill to expand access to safe consumption sites. As I said, ministers have to work within the mandate that they're given, and governments have to work within the areas that they have a mandate. Decriminalization isn't necessarily something that will happen overnight, but I think the more that Canadians talk about it in terms that aren't scary, this is not not about advocating or condoning that people should use illicit drugs or should use high-risk medications necessarily. This is about making sure that people who already have substance dependence have their issues treated in a way that is fair, that recognizes that they have a health issue, that there's a real social justice component to the numbers of people who do die from opioid overdoses. And the more that we talk about it as a society, not in sensational terms, but in rational, evidence-based terms, the more Canadians will understand that that is the approach, and they will be crying out to government to do what's right.
Now, we should mention, so that the audience is clear, in the McLean's piece, you talk about decriminalizing the possession of small amounts of drugs, a personal 10-day supply. You also talk about Switzerland's example of expanding access to safe supply. I wonder, when we look at the politics of this, which you were just talking about, we think back to the last election campaign. In fact, Andrew Scheer spent part of the campaign suggesting, he actually put out the Conservatives put out a flyer saying that the Liberals were going to legalize hard drugs. Do you think that it is just too politically toxic, I guess, at this point?
Well, I would say that it's politically challenging, and I think that's why you actually saw, even in the last campaign, sadly, that there was very little discussion about this from any party, even parties like the NDP, who have traditionally been more open to talking about decriminalization. But it did not reach the proportions of conversation that one would have liked to have seen, and that certainly, as I say, this is probably the biggest public health threat facing our country right now, with opioid overdose death being in the top 10 leading causes of death in this country. So politicians have to stop making it a frightening issue and start to have sensible conversations. People are afraid of the word decriminalization. We don't need to talk about it in those kinds of terms. What we're trying to say in this case is that there are people who use drugs. There are estimated to be 1 million Canadians that are at risk of overdose because of either occasional or regular use of drugs that could be contaminated with products like fentanyl and carfentanil. And when we've got that many Canadians whose lives are literally at risk, then we need to be talking about how are we going to address this in a manner that's fair and that recognizes this is a health issue. There are very few other health issues that we have abandoned because of our fear of political challenges associated with them in the way that we have problematic substance use.
Do you believe that there are politicians around the cabinet table right now, perhaps political staffers as well, who see this issue as you do?
I am quite convinced of that. You know, I think there are politicians actually of all stripes. I've heard from people across the political spectrum who agree that this is the approach that we have to take. So I increasingly encourage those who are advocating for more progressive approaches to drug policy to be patient with politicians to a certain extent, and to find out how we can help them to help those who are in need, and to support them, recognizing that it is politically challenging. But the more that people like you and I and others socialize this conversation, as people like to say, the more Canadians will get comfortable with recognizing that any one of our friends or family members or neighbors could potentially be at risk of death or other harms associated with drug use. And we need to make sure that we take the approaches that other countries have already taught us will save lives.
I wonder if at a moment like this you wish that you were still around the cabinet table to be advocating for this particular position, or do you feel that you're able to make more progress from outside?
Well, you know, it was a huge privilege to be at the cabinet table for about 3.5 years, but I certainly know that there are many ways that a person can use the opportunities that they have to advance causes and policies that are in the public good, and I will have no doubt many opportunities to be able to talk about these important issues and to be able to help improve people's lives.
Okay. Thank you very much for your time today, Dr. Jane Philpott.
Thank you.